It's Friday, October 4th, and this is the Daily Medical News, where we bring you the top clinical medicine headlines of the day, plus an in-depth look at today's biggest story. I'm Nick Andrews.
And I'm Molly Collegio. Today, the 6 factors that help predict response to triple therapy in asthma.
Maternal lead levels are linked to childhood obesity.
Teens with ADHD have a significantly higher pregnancy rate.
And a new protocol could quickly rule out myocardial infarction in the emergency room, with the potential to save billions of dollars each year.
Plus, osteoporosis is a huge burden among older adults, and costs are soaring.
Up first today, there is growing evidence that triple therapy in a single inhaler can significantly cut asthma exacerbations compared with a 2-drug inhaler. But now researchers have identified the type of patients who are the most likely to benefit. Those insights come from a pre-specified analysis of 2 phase 3 trials and were presented at the annual Congress of the European Respiratory Society in Madrid. Dr. Dave Singh, a professor at the University of Manchester in England, outlined the 6 easily identifiable factors that are associated with the best response to treatment. These factors, he said, could help in the treatment step-up decision at the point of care. The 6 factors for better response are: 1. Having a high degree of reversibility, defined as greater than 400 milliliters. 2. Having a BMI less than 25, considered normal body weight by the CDC. 3. Having only 1 exacerbation in the past 12 months. 4. Having never smoked. 5. Being younger than 65 years old. And 6. Being male. Dr. Singh cautioned that the list is still exploratory, but he said it's a step in the right direction and could be valuable for individualizing therapy.
Children born to mothers with high blood levels of lead have a greater risk of being overweight or obese, especially if their mothers are also overweight. That's the finding from new research reported in JAMA Network Open. And the results support the hypothesis that the obesity epidemic could be related to environmental chemical exposures in utero, the researchers said. The prospective cohort study looked at more than 1,400 mother-child pairs who were seen at Boston Medical Center from 2002 to 2013. The researchers collected blood samples to measure lead and folate levels and measured body mass index. They found that detectable lead was present in all the mothers' blood samples. Children whose mothers had a red blood cell lead level of 5 micrograms per deciliter or greater had a 65% greater odds of being overweight or obese. That's compared with maternal lead levels of 2 micrograms per deciliter. There was a dose-response association between maternal lead levels and overweight children that did not change when adjusted for a number of factors, including children's blood lead levels, maternal age, cesarean delivery, and race. Nor did it change when adjusted for children's physical activity. The association increased when mothers were overweight. But there is some good news. High folate levels appeared protective against obesity. Children in the study had a 41% lower risk of being overweight or obese if their mothers had plasma folate levels of at least 20 nanomoles per liter.
New research suggests that girls with ADHD may be at greater risk of a teenage pregnancy. The findings, which were published in JAMA Network Open, come from a large Swedish nationwide cohort study. The study reveals a striking statistic. While the overall rate of teenage births in the cohort was 3%, the rate among those with ADHD was 15%. That's a greater than 6-fold higher odds of giving birth before the age of 20. The study examined data from nearly 400,000 first-time mothers who gave birth between 2007 and 2014. Of that group, about 2% had received treatment for ADHD. The researchers noted that women with girls with ADHD may be less likely to receive adequate contraceptive counseling and less likely to access or act on counseling. They may also experience more adverse effects from hormonal contraceptives. The Daily Medical News will be right back after this.
Researchers in Scotland are aiming to solve a thorny emergency department problem: how to rapidly determine if a patient is having an acute myocardial infarction without sacrificing patient safety. Dr. Nicholas Mills is the chair of cardiology at the University of Edinburgh and led the historic study. That's short for high-sensitivity cardiac troponin at presentation to rule out myocardial infarction. The study compared two approaches. The first is the standard of care, which uses high-sensitivity cardiac troponin 1 testing at presentation and again in 6 to 12 hours. MI is ruled out if the troponin levels are not above the 99th percentile. The experimental approach involves early rule-out. Dr. Mills explains.
The high-stakes pathway is easy for clinicians to use. The adherence to the pathway across 7 hospitals, many hundreds of different clinicians during the trial, was over 92%. Simple and pragmatic. If your troponin concentration is below our low-risk threshold, a single test is all that's required. If it's above the 99th centile, the diagnostic threshold, then patients require admission for hospital in order to understand what the mechanism of injury is. And that small group in the middle require a second test in the emergency department to make sure that troponin concentrations are not increasing. So we have, I think, distilled the power of the test into a simple algorithm that clinicians seem to follow carefully.
In the 2-year study, the new approach reduced the length of stay in the emergency department by 3 hours and increased the number of patients discharged directly from emergency department. But does it meet the safety threshold?
We followed up all patients for 1 year for a primary safety outcome of myocardial infarction or cardiac death following discharge from hospital and found no evidence of harm associated with implementing this pathway.
The new approach also has a lot of potential for cost savings. By reducing length of stay in the emergency department by 3 hours, the new approach could potentially save more than $3 billion a year in bed occupancy alone, researchers said.
And finally today, the burden of osteoporosis remains high in the United States, with both fractures and costs rising. Dr. Nicole Wright is in the Department of Epidemiology at the University of Alabama at Birmingham. She was part of a team that examined changes in osteoporosis burden for the 4th edition of the Burden of Musculoskeletal Diseases in the United States, which was published by the U.S. Bone and Joint Initiative. She provided an overview of current osteoporosis trends at the annual meeting of the American Society for Bone and Mineral Research in Orlando, Florida. Overall, there's an 11% osteoporosis prevalence for adults aged 50 years and older. That's higher for women at 16.5%, but the condition hits Asian women the hardest with a prevalence of 40%. The researchers also looked at fracture sites over time. Hip fracture prevalence is up, while there has been a decrease in the prevalence of spine fractures. Costs continue to climb. The direct cost of osteoporosis was $73.6 billion between 2012 and 2014. That's 118% higher than the period between 1998 and 2000, when costs were just $28 billion. That price tag includes ambulatory care, inpatient costs, and prescription drugs. Dr. Wright said the condition remains costly because it results in so much healthcare utilization, and even while some fractures decline, others are on the rise. And that's it for today's daily medical news. Remember to look for the latest episodes of the CardioCast and the Post Call podcast. CardioCast and Post Call drop new episodes each Friday. They're available wherever podcasts are found. For MD Edge, I'm Nick Andrews.
This week, our stories were contributed by Michelle Sullivan, Alicia Gallegos, Jake Ramali, Richard Franke, Susan London, Lucas Franke, Steve Cimino, Carrie Dooley Young, Jeff Craven, Bruce Jansen, Ted Bosworth, Kayla Brands, Heidi Spleet, Bianca Nogrady, and Tara Haley. Our editors include Terry Rudd, Kathy Scarbeck, Denise Fulton, Therese Borden, Katie Lennon, Glenn Williams, Richard Peasy, Laura Nicolaides, Catherine Nellist, Jeff Evans, Elizabeth Meshkati, Laura McGlade, Mark Lesney, Gina Henderson, and Catherine Hackett. Our editor-in-chief is Mary Jo Dales, And I'm Molly Calagio. If you like what you hear on the Daily Medical News, please leave us a review or a rating on Apple Podcasts. And check out the full stories available via the links in the podcast notes. Have a great weekend, and we'll see you back here next week.